colleague Tom Coburn from Oklahoma, with Congressman Nunes from California and Congressman Ryan from Wisconsin. We're here to, I guess, be the first to launch the specifics of health care reform. I think what you will hear today is the boldest approach to health care in decades in the United States. In simplistic terms, our plan will transform health care from a U.S. health care system that triggers when people get sick to a health care system that embraces and incentivizes prevention, wellness, and disease management. Those are three words you're going to hear when anybody discusses health care reform this year. But few will meet the test of actually constructing a health care model that puts the incentives in prevention, wellness, and disease management. Those members that are here today, and we've been joined by Lamar Alexander, my colleague from Tennessee, those pieces of health care, prevention, wellness, and disease management are absolutely essential if we're to reduce the overall cost of health care in the United States. But in achieving true prevention, wellness, and disease management, we also increase the health of the American people. We provide incentives through private insurance that allow individuals to make healthy choices, to get the treatments when they need them, where they want them. It embraces employer-based health care, it embraces private marketplaces, and it allows individuals to not be discriminated as they are today with large group pools. Our plan attempts to bring more people under the coverage umbrella in private insurance, therefore spreading the risk amongst many more Americans. Last Friday, we sent a letter to our nation's governors. We shared with them the introduction of this plan. We also made it very clear to them that this plan would present them an option of folding their Medicaid population into this private sector plan. The first real opportunity that the state's governors have had to get out of the health care business, to allow the pool of insured in this country to grow, and to allow those companies that are now incentivized to actually be able to treat the Medicaid population without a Medicaid M on their forehead. We're chasing the primary care out of emergency rooms, and we're creating a medical home for every American. We're setting up the avenue so that education can be done on disease management. We're also opening for Medicaid patients a new group of providers, those that refused to take Medicaid beneficiaries before because the reimbursements were so low. This will be a whole new world towards the quality of life for any Medicaid beneficiaries that are in states where governors choose to include them in this plan. With me today, as I said, I'm going to turn the podium over to Paul Ryan, who's going to get into some more specifics about the bill. Paul?
Thanks, Senator Burr. Good morning. What we are doing here today is we are showing that America can have a system of universal health care access without the government running it. The Patient Choice Act shows how to give all Americans access to affordable coverage where the patients and the doctors are in charge, not the government. The current tax treatment of health care, which is a relic of World War II, discriminates against the self-employed, against the unemployed, and against those people who do not get health coverage at their jobs. This may have worked in America when everybody had the same job throughout their lives and throughout their careers. That's not the America we have today. A lot of people change their jobs. So the tax benefit should change and go with them and not be attached to their jobs. We want to address job lock. So the key question that ought to be addressed in any health care reform legislation is, are we going to continue job lock, or are we going to allow individuals more choice and portability to fit the 21st century workforce? We propose to equalize the tax treatment of health care, giving every American, regardless of employment status, the ability to purchase health insurance. And if you like what you've got, you can keep it. If you like what you have at your job, you can keep it and apply your tax benefit to that. This will result in for a vast majority of Americans in a net tax cut. We propose to replace this discriminatory tax exclusion with advanceable refundable tax credit of $2,300 per individual and $5,700 per family. It's a concept that was previously championed by top economic advisors in the Obama administration. The Patient's Choice Act transforms our broken health care system with perverse incentives and skyrocketing costs into a vibrant health care market where individuals and families reclaim ownership of their coverage and ownership of their health care decisions. As I mentioned, if you like what you've got, you can keep it, and you'll probably end up with more money in your pocket at the end of the day. For non-taxpayers, for those whom the credit is advanceable and refundable, we provide a credit in the same amount, but the funding for the credit is generated by savings in entitlement programs. On top of that, Medicaid and S-CHIP populations will get additional assistance to cover out-of-pocket costs. This removes the stigma associated with second-class health care that the Medicaid population is experiencing today. Right now, those folks on Medicaid are going into the doctor's office and being denied. They are going through health care with second-class system. We want to give them the dignity of private health insurance that everybody else in America is enjoying and that everybody should enjoy in America. Medicaid families will get the same $5,700 tax credit available to the rest of the population, in addition to a supplemental card with up to $5,000, so up to $10,700 for low-income families to pay for health care coverage. The ongoing debate with taxes and health care represents a clear difference between the two approaches here in Washington. The President and the Democrats discuss tax reform as a means to get greater revenues into Washington, with the idea that the federal government knows best. Their government-centric approach will require massive tax increases, seeking to chase ever higher spending with ever higher taxes. We believe in a patient-centered model, and we remain firmly committed to directing the resources and the decision-making power with individuals. You see, we already spend twice as much per person on health care in America than all the other industrialized countries. The answer is not a massive new tax increase and massive new spending programs. The answer is to take the money we're already spending and spend it far more efficiently, far more effectively, to reflect the dynamics of the 21st century so that the center of this system is not politicians and bureaucrats making the decisions. The center of this system is patients and their doctors making the decisions.